Welcome to the 2018 ASHP Foundation Literature Awards presentation and breakfast. Since 1971, the program has recognized 731 authors and 167 articles published in the biomedical literature. The Student Research Award goes to Matthew Gray and his co-authors. Their article, Outcomes of Patients with Atrial Fibrillation Newly Recommended for Oral Anticoagulation under 2014 American Heart Association, American College of Cardiology Heart Rhythm Society Guideline, was published in the Journal of the American Heart Association.
The American Heart Association works together with the American College of Cardiology and American Rhythm Society to develop guidelines for the treatment of atrial fibrillation. These guidelines are considered to be the gold standard of care in the United States, and in 2014, an updated version of these guidelines were released. Included in this was a change in the recommendation of when to initiate anticoagulation using the CHADS-VASc score instead of the older CHADS-2 score. Previously, anticoagulation was recommended to be initiated in patients with a CHADS-2 score of 2 or above, but would now be recommended in patients with a CHADS-VASc of at least 2. Due to the more inclusive nature of the CHADS-VASc score, and the high prevalence of AFib in the United States, this decision implicated that upwards of hundreds of thousands of patients would now be recommended to receive lifelong anticoagulation that were not before. We sought to describe the outcomes of these patients in terms of stroke reduction and increased bleed risk as a result of this new recommendation. This was an important topic because of the very large number of patients that this policy decision affected, and no studies had previously described the outcomes of these patients in a U.S. population.
The Pharmacy Practice Research Award goes to Almut Winterstein and her co-authors. Their article, Development and Validation of a Complexity Score to Rank Hospitalized Patients at Risk for Preventable Adverse Drug Events, was published in the American Journal of Health System Pharmacy.
This research was really the perfect alignment of our prior work and a concrete clinical need that was defined in the ASHP Practice Advancement Initiative. Our team had worked on the identification and measurement of preventable adverse drug events in inpatient settings since early 2000. Then, in its mission to support and transform pharmacist roles as direct patient care providers, the ASHP Foundation released a request for proposals that asked for the development of a scoring instrument that would allow positioning pharmacists with the patients who would most benefit from their clinical work, that is, those patients at greatest risk for preventable adverse drug events. We were fortunate to win this competitive contract and have worked over 3 years to develop the complexity score that is summarized in this manuscript. The score uses EHR data to predict risk for a total of 16 severe adverse drug events that occur in inpatient settings and that we believe could be prevented, at least in part, through pharmacist-guided drug therapy management. The score can be used like any clinical decision support tool, but rather than alerting about a single drug therapy issue, it takes a holistic, patient-centered approach in summarizing a variety of patient and drug therapy characteristics that may lead to an adverse event. Importantly, the score avoids false positives and the resulting alert fatigue. For example, if pharmacists focus their attention on patients in the upper 10th percentile of the C-score, they will have selected a population where more than half will experience a severe adverse drug event that day. I'm very excited about this innovative patient-centered approach to guide and improve drug therapy and see prediction models like the C-score as a very important facet of precision medicine. I'm hopeful that we can continue our work in advancing and implementing the C-score and would like to express my appreciation and gratitude to the ASHP Foundation for supporting and recognizing our work.
The Drug Therapy Research Award goes to Kirk Evoy and his co-authors. Their article, Abuse and Misuse of Pregabalin and Gabapentin, a Systematic Review, was published in Drugs.
As the number of drug overdose deaths continues to climb and reach new record highs, reducing overdose deaths has become a major priority among practitioners and legislators alike. And because opioid analgesics are the drugs most commonly implicated, much of the focus has been on reducing opioid prescribing and opioid-related harm. However, several years ago, as scrutiny of opioid prescribing mounted, I began noticing a major shift in prescribing patterns in our clinic. Providers were appropriately trying to reduce opioid prescribing as much as possible. However, what I noticed was that this led to a significant increase in utilization of alternative analgesics, and in particular a major increase in the use of gabapentin and pregabalin in our clinic. Having previously presented on gabapentinoids as emerging drugs of abuse, I wondered if this major change in utilization, which has been documented in studies of prescribing trends beyond just my anecdotal inference, had correlated with greater abuse of gabapentinoids. Therefore, I conducted a systematic review, finding what to me was a much higher than expected 59 articles describing gabapentinoid abuse, the vast majority of which have been published within the last 3 or so years, despite the fact that gabapentin's been around for almost 25 years. If I had to summarize my biggest takeaway points from this paper and why it's impactful, I would say a couple things. One, at this point, there is an undeniable body of evidence showing that gabapentinoid abuse is on the rise and is becoming a significant concern. And we need to be more judicious in our prescribing of these drugs in high-risk patients, namely patients with a history of opioid abuse. But secondly, more big picture, it is that in light of the opioid epidemic, reducing prescribing of opioids and taking measures to prevent opioid overdoses is of paramount importance. But it should not be overlooked that as we make prescription opioids more difficult to obtain, what are the ancillary effects of these changes? And are the measures we are taking actually decreasing recreational drug use or simply incentivizing abuse of other drugs that are easier to access?
The award for innovation in pharmacy practice goes to Lainey Jones and her co-authors. Their article, Medication Therapy Disease Management, Geisinger's Approach to Population Health Management, was published in the American Journal of Health System Pharmacy.
Geisinger has been providing high-quality, patient-centered medication therapy disease management programs for over 2 decades. Over that time, it has grown from 1 pharmacist in an anticoagulation clinic to 54 pharmacists managing 16 disease states in 49 ambulatory primary and specialty clinics. These pharmacists complete over 32,000 patient encounters per month. We felt AJHP's special edition on population health was the perfect opportunity to highlight and share the innovative work that we have done and continue to do in the area of medication management. While my interest is around familial hypercholesterolemia, which was highlighted in the article, the writing of this article was truly a team effort and involved many of the key stakeholders who run this program on a daily basis.
And this year's award for sustained contributions goes to Dr. Cooper DeHoff, an associate professor in the Department of Pharmacotherapy and Translational Research at the College of Pharmacy and Division of Cardiovascular Medicine and the University of Florida's College of Medicine in Gainesville. She is also Associate Director for the Center for Pharmacogenomics at the University of Florida. Dr. Cooper DeHoff's research interests include pharmacogenetics, hypertension, metabolic syndrome, and diabetes. She currently serves as co-principal investigator or co-investigator on grants funded by NIH Pharmacogenetics Research Network, the Patient-Centered Outcomes Research Institute, and the DoD. Dr. Cooper DeHoff is a fellow of the American Heart Association and the American College of Cardiology. Her work has been recognized with numerous awards, including the Clinical Science Award from the Consortium for Southeastern Hypertension Control, the Best Paper Award from the American College of Clinical Pharmacy, Cardiology Practice and Research Network, and the top population science paper from Hypertension, Journal of the American Heart Association. Dr. Cooper DeHoff has been honored with the American College of Cardiology's Distinguished Associate Award and the American College of Clinical Pharmacy's Russell R. Miller Award. This is the second time she has received an ASHP Foundation Literature Award. She received a UF term professorship last year.
From the time I finished my residency over 30 years ago, I knew I was interested in becoming a researcher. My move to Shands Hospital and the University of Florida in Gainesville allowed me to fulfill that dream. I credit much of my success to my research mentors, Drs. Carl Pepin and Julie Johnson, who together helped me to become the successful independent researcher that led to receiving this Sustained Contributions Award. My research career began in the area of clinical research, focused in hypertension and cardiovascular disease, with leadership in the International Verapamil Trendolepril Study, or INVEST. This study included over 22,000 patients with hypertension and coronary disease from around the world, the largest study ever conducted in this population. One of the highlights from INVEST includes our observation that lowering blood pressure too much, below a systolic of 130, in diabetics with hypertension and coronary disease increases risk for death. Our finding continues to inform hypertension treatment guidelines in this population today. We have published many papers from the INVEST study over the last 2 decades, and it continues to serve as an important data set for new trainees and seasoned investigators alike. From there, I expanded my research program to the area of pharmacogenomics and pharmacometabolomics, with the goal of identifying omic signals that contribute to blood pressure response or adverse events. Our lab has identified and confirmed many potential biomarker signals in the area of antihypertensive medications, especially thiazide diuretics and beta blockers. These signals can be used for a more personalized approach to medication selection. For the last 10 years, I've led an international consortium to continue to move this field forward, and our work has led to many seminal papers in this field. Recently, I have turned my focus to the area of precision medicine education and implementation. Over the last year, I have built a new program in precision medicine graduate education, which includes a graduate certificate and a master's degree, and the first students enrolled in the program this fall. And I have just been named the director of the UF Health Personalized Medicine Program, which is one of the premier programs of its kind in the U.S. My sincere thanks goes out to everyone from my trainees to my colleagues, my mentors, and UF support. This kind of work takes a village.
Congratulations to all of this year's ASHP Foundation Literature Awardees.